Okay, we're continuing with the book Hidden History of Nutrition, Health, and Science. The next person we're going to talk about is Gregory Sloop MD. He is a pathologist and he is the father of what is called atherothrombosis theory. Actually, they did know the pathologists back in the 1800s that atherosclerosis was a blood clot, and they described it that way, but it didn't get into widespread knowledge. And then after Ansel Keys, 1950s, 1960s, with all this concern about saturated fat and elevated blood cholesterol, then they started selling the statin drugs. People sort of forgot about atherosclerosis being a blood clot. Plus, you have all the surgeons trying to bypass it. You've got the cardiologists, angioplasty and stenting it. So nobody was really interested in the pathophysiology of it, what causes it. But what Gregory Sloop said is, you look at it under a microscope, and it's a blood clot. It looks like an organizing hematoma. The clot forms, the immune system comes into it and tries to clear up the clot. Okay, and then it forms, dissolves. So it looks like a tree stump with lamination with the different rings from alternating phases of clotting, clot removal, and fibrosis. That's part of the healing process. Okay, the other real famous pathologist is William C. Roberts. William C. Roberts has a YouTube channel just called by his name, William C. Roberts. And he's got some of the best videos ever made on atherosclerosis. And he did autopsies over 2,000 patients who died of heart attacks. And what he found was coronary artery atherosclerosis is always diffuse. So that's a key word, always diffuse, meaning it's in all of the four epicardial coronary arteries, the left main, left circumflex, left anterior descending, and the right coronary. It's in all of them, and of similar severity. The relevance is that all this stuff about single vessel disease, let's just angioplasty and stent the single vessel that's diseased, or we'll just bypass a single vessel that's diseased, that's actually nonsense. It's always in all of them, okay, and of similar severity. Cardiac cardiac angiogram was often missing some of the stenosis because you only get a limited number of views. You can't have unlimited radiation of the heart as you try to obtain a decent view. And they'd also compare a normal segment. They compare a stenotic segment, a narrowed segment, to an adjacent, lesser severity stenotic segment, but not to a true baseline. So they're underestimating the extent of disease on a cardiac cath because they thought they were comparing it to a normal segment. They were just comparing it to an adjacent segment that was also diseased, just not as bad. All right, so anyways, his theory is atherothrombosis. Atherosclerosis is a blood clot. And that is a giant statement because I'll tell you something. 99.999% of conventional MDs, DOs, they don't know that atherosclerosis is a blood clot. But it's a big deal because as soon as you understand it, then you know that anything that causes blood to clot is an atherosclerosis risk factor. And the reason why high blood cholesterol is an atherosclerosis risk factor is that it sticks the red blood cells together. So if you got a red blood cell, it's going to have a negative charge on it. And the two red blood cells with their negative charges, they're going to repel each other. Okay, that's what you want. Let's just say these markers are two red cells. They're going to repel each other. But if you have fat, the fat, let's say this yellow thing is fat, the fat's going to overcome the negative charge and it's going to stick them together. And once it sticks them together, then it becomes harder to push them through a capillary. Capillary's got a diameter about 5 microns, typically red blood cells about 7 microns. So you have to push under higher pressure. And when you push under higher pressure, you're going to damage the arteries. And that damage to the arterial wall causes shedding of the antithrombotic glycocalyx, the arterial lining, which has a negative charge on itself. The negative charge is called the zeta potential, by the way. And so then it becomes prothrombotic, and the red blood cells stick to it. So hypertension causes atherosclerosis. Diabetes also causes atherosclerosis by damaging the arterial wall as well, microvasculopathy it's called. So anyways, it all makes sense. Does that work for you? And it's not just the fat. It's also, by that I mean it's not just the chylomicrons, it's also the LDL cholesterol and it's also triglycerides that will lead to red blood cells sticking together, okay? And we talked about it. If you have leaky gut, the bacterial endotoxins, LPS and LTA will stick them together. If you have fibrinogen, if you have excess iron in the blood, you'll get ferrous redox cycling from Fe2 plus to Fe3 plus. That'll get the fibrinogen to cause clotting in the blood. So there's a lot of things that cause clotting in the blood. They're all atherosclerosis risk factors. So is stress, so is caffeine, so is sleep deprivation. Those are all similar things. So is dietary sodium. It inhibits endothelial nitric oxide synthase, so you have less nitric oxide. Nitric oxide not only vasodilates, it prevents platelets from clotting. It has an antiplatelet effect. So without the nitric oxide, the platelets are more sticky. Anyways, that's a giant discovery. I mean, that's big stuff. Atherothrombosis is the unifying theory of atherosclerosis. It's the secret to knowing. I actually became friends with him. I talked to him on the phone a bunch of times, and the guy's a genius, and he spent a long time figuring this all out, looking at it under a microscope. And pathologists are the best experts on atherosclerosis because they don't care. A surgeon always has to praise surgery because that's how they make their money with the bypass graphic. A cardiologist has to praise stenting. That's how they make their money with a stent, okay? An internist has to praise drugs. They make their money selling drugs. But a pathologist, he doesn't care how you treat it, so they're more able to reach objective truth, okay? This is his book, Blood Viscosity and Its Role in Cardiovascular Pathophysiology. And blood viscosity just means the more the red cells stick together, the thicker the blood gets. Viscosity is thickness, so you get thick blood. When the reason you have blood pressure is to pump blood to your brain against gravity. So if you're pumping thick blood, you're pumping a milkshake instead of pumping water, pressure has to go up. So anyways, that is the big discovery of Gregory Sloop for atherosclerosis, and that was a turning point in understanding atherosclerosis. I'll put some links in the description below. You also get atherosclerosis in the vasa vasorum, and that weakens the arterial wall and predisposes it to aneurysm. I'll talk about that in a future lecture. Anyways, I hope you found this helpful.